Hello and good day, everybody. This is Module 1 of Topic 1. What is COVID 19 of Morton College's Contact Tracer Certificate Program? In this topic, we are going to describe what COVID 19 is and where it came from, describe how COVID 19 is transmitted, describe prevention measures for transmitting COVID 19. Describe the signs and symptoms of COVID 19, and also differentiate between severe and non severe symptoms of COVID 19. Before we get into the basics, it's important to say that because this is a novel coronavirus, meaning it is new, there is a lot that we are still learning about this virus, a lot that still needs to be known. So what's in this topic is the most current information that we do know about COVID-19. So what we do know that this virus was identified in Wuhan, China in 2019. COVID-19, we are terming a name as the disease. So if someone has a positive test, we say they have COVID-19, say disease. The virus that is causing this disease, so what testing is looking for, what strand of the virus is termed SARS-CoV-2. That's the name of the virus. And this virus can cause mild to severe respiratory illness. By that means that some people get mild symptoms. People with mild symptoms can maintain and monitor their symptoms at home. Severe respiratory illness would cause a patient to have to go to the hospital. They might need a ventilator to help them breathe. They might need supplemental oxygen to get some extra O2 going through their body. So it all kind of depends on the person. There's no set course of this disease at this time. The virus is said to have come from bats. However, the exact source is unknown, but somehow this virus did come from a bat in some way. When we talk about viruses, there are three main ways viruses are transmitted, and that can be through contact, droplet, or airborne, is what we say how a virus is transmitted. So for example, if we talk about measles is actually it's transmitted airborne, meaning that it can live in air particles without being directly transmitted from a person to person right away. Measles is very, very highly contagious. When we talk about how contagious it is, there's this R naught value, and that value stands for if one person's infected, how many people that one person can infect. So with measles, the R naught value is actually 12 to 18. So that means if one person has measles and there's no way to stop the spread, so no one's vaccinated, there's no cure, 12 to 8, that person can infect 12 to 18 others. When we talk about COVID-19, what we know of so far is the R naught value is about 2.2 to 2.7. So what that means is that the virus can be transmitted to about one person. It's going to transmit the virus to 2 to 3 others without any kind of stop of transmitting the virus. So with COVID is said to be is spread through respiratory droplets. The most highly contagious way this is spread is from person to person. So the person needs to be within close contact, which is defined within 6 feet. Those respiratory droplets produced by an infected person when they cough, sneeze, or talk. Then these droplets can land in the mouth or nose, or even be inhaled through the lungs, maybe even through the eyes of another person, and then that's how that person gets infected. So this is droplets. Droplets are being transmitted here. COVID-19 can be spread by people who are not showing symptoms. We call these asymptomatic people. There is a possibility of that. What we know about that is still being researched, and there's more to come on asymptomatic spread. One other way that this virus can be transmitted is from surface to person. When COVID-19 first, let's say, came about, it was said that this virus was highly being spread from surfaces to people. And now, after much research has been done, that we actually found out that that's not so true as we thought in the beginning. It can be spread this way, but the most highly contagious way of the spread is from person to person. So from surface to person, this would happen if you touch a surface or an object that has the virus on it, and then you touch your mouth, your nose, or your eyes and transmit that into your own body. And again, it's not thought to be a main mode of transmission anymore. The last possible way is from animal to person, and this is also not considered a highly way of transmission. But it is still there. There are some ways that this has been transmitted, so it's on there. So our 3 main ways: person to person, surface to person, and then animal to person, with person to person being the most transmitted way of this virus. Ways to prevent transmission: maintain good social distancing. What that means is stay 6 feet away from others. Wash your hands frequently with soap and water or hand sanitizer with at least 60% alcohol. Routinely clean and disinfect frequently touched surfaces. So that means clean surfaces with some kind of hot soapy water, and then also disinfect those surfaces. Cover your mouth and nose with the cloth face covering. When we talk about washing our hands, we have 2 main ways. We have hot soapy water and we have hand sanitizer. So how do you know when to use one over the other? Well, you want to use hot soapy water for at least 20 seconds when your hands are soiled in some way. This is actually your go-to. You always want to try this first if it's an option. If you sneeze on your hands, if someone sneezes on your hands, if you touch a surface where you feel like you might have soiled your hands in any way, you definitely want to use hot soapy water. If you're, say, going to the grocery store and you just want to sanitize your hands prior to going in, you can go ahead and use the hand sanitizer. And then always when we're out in public, we're using those cloth face coverings, which are recommended by the CDC and pretty much mandated in all states right now. And it can be any kind of cloth base covering. All right, so signs and symptoms of COVID-19. We have fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, diarrhea. These signs and symptoms can actually take up to 2 to 14 days to develop. On average, people are showing signs and symptoms about 5 days after contracting the virus is when the majority of people are showing their signs and symptoms, but also some people have no signs and symptoms. Some have some and not others. It all kind of depends on the person. So it's important to know all of these are signs and symptoms of COVID-19. Severe signs and symptoms. These are symptoms that need medical attention. You need to call 911. You need to get to a hospital. You need to talk to a healthcare provider immediately. Whatever it is, you need some kind of medical attention. You cannot monitor these symptoms on your own. These are trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. These last three bullets are more linked to the fact that because this is a respiratory illness, your oxygen levels might be lower than normal. So when you don't have enough oxygen to be circulated through your body, it's very, very likely that you can become confused. You're unable to kind of stay awake. You're very drowsy, and you have this bluish color that comes to your lips or face, and that's a sign that your body needs more oxygen. So something's happening in your lungs when that's providing your body the inability to be able to have enough oxygen to function properly. So you have to seek medical attention. And that is the last thing we're going to talk about in this topic. If you want any more information on anything on this topic, you want to go ahead and visit these websites that are available, and I will see you in topic 2.